Good afternoon, everybody. Welcome to our session. I'm Kathryn Howe. I'm the Director of Healthcare for Cisco in the Americas organization. I'm thrilled to be able to join you this afternoon and talk to you about one of our favorite topics, telehealth, but really about telehealth in the context of it being one of the major catalysts for the digital transformation overall of the industry. That's what I'm focused on at Cisco. As the Director of Healthcare for the Americas, I spend my days and evenings and weekends working with folks like you from all over the country who are really trying to take on the concept of really creating a digital transformation for their organization that impacts everything across the enterprise, from patient care to clinician experience to operations, and to data and analytics. And that's the focus of my background and my discipline at Cisco. So I'm going to talk a little bit about that today, but I'm going to funnel down pretty quickly to telehealth in particular, because I know it's really top of mind for a lot of people. And there's so much going on in the space. So to start the conversation, I want to step back and talk about a little bit of the undercurrent, many of the undercurrents that are going on that are really driving the digital transformation of the whole industry. And as I go through this today, by the way, don't forget to feel free to post questions in the Q&A area of the system, and we'll try to answer them online while we're going through. And of course, at the end, I'll share my contact information. You can always reach out to me directly if there's questions that didn't get answered. So when we think about some of the real driving forces behind the digital transformation of the industry, of course, as you see across the very top row here, access to care has several things happening that are really pushing the digital transformation. Telehealth, of course, biggest change in access to care, because not only is it more convenient and it neutralizes the boundaries of the physical divide provides, it also is a more cost-effective manner of reaching people and people reaching us. And it also lends itself to scale, to reach areas where people don't have physical access, or people who just aren't ambulatory. And we'll talk a whole lot more about telehealth as we go on. But another one is the shift in the location of care. So more and more of the standard evaluation management visits have always been predicted to be shifting to the virtual care environment, but they're also shifting in general away from the hospital environment to the home, to the skilled nursing facilities, to the outpatient clinics, even outpatient surgery, ambulatory clinics. So there's so much going on that's moving the location, and that means that that digital connection becomes really important, not just for the patients, but for the clinicians as well. And this will come into play more and more and tap that telehealth system, tap that virtual care system. The last one on the far right there is something that we all hear all the time, the consumerization of the industry. It's something that's happening, and it's being driven by patients being more demanding about how they interact and wanting access 24 hours a day, and even just like they do in the rest of their life, whether they're reaching out to schedule a flight or a hotel room or shop or replenish supplies for the house. All of that can be done at any time when they get a breather and can go online and do that. And they expect a similar capability when they're trying to schedule a doctor's appointment or cancel one or look up something, a test result or something. And so the consumerization is often thought of as just that. How does the patient view and experience their engagement with the healthcare system? But the consumerization of anything is really about making that thing, the product or service, more mass consumable. And what that means for healthcare is very interesting, because our product, our service, is always historically resided in the human form, in the minds of the clinicians who have experience and education and lots of data sitting in their brains, and we're trying to get, as patients, to access to that as a product or service. And really to make that mass consumable has been a challenge. And for a long time, healthcare was sort of a laggard in adopting digital transformation because the industries who led in digital transformation were those whose product or service could be digitized itself. So things like film and music and software, that product could be digitized. And so transformation of those industries happened really, really quickly, and a lot of disruption took place. But not so much in healthcare because we always viewed it as a human-to-human interaction. So what we really need to do, and what the technology has allowed us to do, is to really make our product and service more mass consumable. And that means getting that very coveted information is in any ways that we can into the machines and out of the humans. And that way the machines can aggregate thousands and thousands of data points, whether it's PACS images, CT scans, or it's test results, or it's practical clinician knowledge. Getting that into the machines allows artificial intelligence and machine learning to act on it, to create predictive models, and to make it mass consumable for the general public. It lowers the cost, it creates a broader scale for access, and it changes the labor model around it. So now this is going to play into telehealth, because if a lot of the first questions or evaluations are happening by the machines, the interface, the person that is on the other end of your telehealth visit doesn't necessarily have to be that 30-year experienced clinician. It can be somebody with less experience maybe who really understands what the reports and algorithms are telling them. And of course, that again lowers the cost, gives us more access to people who can do that role, can perform that role, and it makes our service of healthcare more mass consumable. And we will see this as telehealth develops into a more and more mature part of the healthcare delivery system. That next row down there, talking about operational shifts. We've talked a little bit about the tools. The tools are coming at us really fast. So AI, machine learning, I've talked about a little bit, but there's a lot of tools out there we still haven't tapped into. Blockchain, more artificial intelligence, predictive modeling. So there are more and more tools that are going to be hitting us in telehealth, or healthcare rather, that are going to open doors for different kinds of capabilities on the operational side. And then there's security. We are all very, very aware of the importance of security and privacy and compliance. But cybersecurity is coming to the top of the list for a lot of healthcare providers now, not only because of the recent couple of weeks we've had where we've seen some of the largest breaches of malware and ransomware attacks going on in the healthcare industry, the largest we've ever seen in the United States. But that coupled with the fact that the value of the healthcare record outweighs the value of the consumer record in any other industry. And coupled with the fact that we don't have a culture in healthcare of every single person being accountable for cybersecurity like we do in other industries. I often talk about how the airline industry, in that industry, everybody's accountable for safety. Whether you are one of the maintenance people on the tarmac who sees something that's a safety risk, you can call out that and actually down a plane because you see a safety hazard. Or if you're a flight attendant, or of course a pilot, anybody can make that call, and people are all vested in doing that. In healthcare, we haven't gotten there yet. We have a very vulnerable workforce who is exhausted right now on the front lines, and there are malicious attackers who are very happy to send them a text notice saying, click here for a free N95 mask, and without thinking, that gets clicked on. This is called smishing. It's the SMS form of phishing, where you actually get that in a text message and click on it and introduce malware into the organization. So we need to shift to a culture, as well as have very hard and fast security capabilities in our infrastructure, but also have a culture where people are very aware of reporting these things and not clicking on them. And then there's the disruption of the healthcare models in general. And we've seen a lot of this from the chain drug retailers, transforming into care delivery service vehicles like Walmart, Walgreens, CVS, and even Amazon. All of these are sort of nibbling away at the core business. And from an operational standpoint, this is driving change to either partner with these folks or embrace some of the concepts of the clinical and distributed models that they've got. But whatever it is, that disruption is right in the middle of what we're building and what we're delivering. And so it becomes an important consideration. And then the final two that I've added on the bottom there should not go unnoticed. These are sort of, they're not operational and they're not about access to care. They're more about these macro undercurrents that are affecting the way we work, the way our patients are engaging with us, and just about every aspect. So one is behavioral and mental health. It is, as a department of medicine, driving a whole lot of change. It is really being disrupted right now, and we're seeing more and more ways or modalities that patients are engaging in their behavioral and mental health care. And it is more of a 24/7 way of engaging. It is more digital, and it is becoming something that is really causing a lot of shift in the technology and in telehealth, the way we encounter with these patients. And it's also impacting our own staffs in the provider organization. So this concept of clinician burnout, which we're all very aware of because of the stress that all of our frontline workers are under, we are now needing to use some of the concepts that we know in behavioral health that we use with our patients. We're needing to use them on our staff as the HR department looks at dealing with trauma on the front line in a very intensive environment that has a lot of risk associated with the wellness of the staff. And that has become a very, very big component of why we're changing some of the ways that we work and we help our staffs work. So clinician burnout is top of mind, and technology actually can come into play in a very positive way as one of the agents of change in combating that. And we'll talk about that a little bit. So this is kind of just a quick walk through the landscape of what is really pounding on the industry and forcing a lot of rethinking. And then there are several other things that are going on all over the enterprise of a provider organization. Things like the device manufacturers who are right in the middle of the care team now as they do remote monitoring, and they collect data that's really important to the providers when those patients come into our organizations. Also, advanced technologies such as graphic processing and deep learning that are taking thousands and thousands of those PACS images and doing predictive analytics on them and doing initial screenings of mammograms and CT scans to accelerate the rate of reading those reports by the radiologists. There's a lot of that happening already, and it's continuing to expand. And then, of course, the wearables and the self-monitoring that's going on at home with devices and self-monitoring capabilities. Mental health I've mentioned before, but it's also very, very digital in terms of apps. There are literally thousands of apps out there that are not only effective for a lot of patients, but they're also accumulating a whole lot of data that's helping with speed up the diagnosis period. So when a patient comes in, that data helps the clinician to very quickly hone in on a possible diagnosis and can vet that out with the patient without spending what used to cost months and months of time. And then, of course, there's other technologies that are being used in mental and behavioral health, such as purpose-built devices like for the opioid crisis. This one up top is a sensor band that measures sudden drops in oxygen, which is one of the first indicators of a potential overdose. And then it alerts a care team, a family member, or what have you, on that individual. The augmented reality is becoming a very safe and scalable way to do exposure therapies, which is what's used in fears of heights, fears of all sorts of, flying, or anxieties about just leaving your house. And of course, avatars and virtual reality for bullying, for social anxieties. So all of these digital things become really important, and a lot of them can be done at home. So people can experience these things without coming into the face-to-face environment. And then the clinician, when they are having a telehealth encounter, needs to kind of start to think about, how do I deal with coaching somebody through a virtual reality experience, or debriefing with them after they've run a couple of virtual reality exercises, and then we need to have the conversation. How can I share in that? How can I be with them through that experience? So there's a lot of things potentially to think about that are going to impact in telehealth. But let me shift now to the actual telehealth or virtual care system itself. And we think about it as a virtual care system. So a lot of people think that telehealth is about that video encounter between the doctor and the patient. And that is a very important part of a virtual care delivery system, but it is not at all the only thing that's happening. It is also about the whole journey of how the patient got to that virtual encounter. How was that appointment made? How was it canceled? Or how was that face-to-face appointment converted to a telehealth appointment? What about things like language translation? What about following up and reminders for prescriptions and medications, or the next appointment? All of this happens in the contact center. So the contact center has become sort of that, a nerve center, the brain of the whole virtual care program. It feeds the virtual encounter, but it also has something that connects to the patient, which we'll call the patient engagement layer, or the different modalities. And this is where that idea of consumerization comes in. How does the patient really interact with the healthcare system now through the contact center? It's not always, a phone call and being on hold. It's various modalities that engage with that phone call. It could be the IVR system that's asking for a little more information if you can respond to the following questions. And that allows the contact center to prioritize those incoming calls. We certainly saw during pandemic that not all calls were able to be answered. The promise of your call will be answered in the order in which it was received. We couldn't even live up to that promise because there was such a deluge of callers. And we had to have systems that would triage those calls. So the engagement layer, IVRs, the chat bots, the texting, all of these things become more and more important because they are the way that the patient interfaces with the virtual care system, and the virtual care system begins to route and orchestrate the next steps in their journey, much of which leads to a video encounter, and then leads to follow-up, like I said, med management, prescriptions, reminders, all of those things. So these three kind of platforms, when they come together, are really how we see creating a successful, sustainable virtual care program in your organization. And there are many, many things that can be optimized and improved through this kind of system. For example, EHR adoption. I don't know if everybody out there knows what their adoption percentage level is right now. How many of your patients actually have a MyChart or the equivalent of an EHR account with a login? Well, they need that, right? Because we want all of the video calls, those virtual encounters, to come through the EHR, and we want the attributes of that engagement to be logged into the EHR. How long was the call? How many people were on the call? Did the call even happen? Was there a screen share? Was there something ordered in the call that needs to be followed up on? All of that needs to be captured. And then going forward, there's going to be more and more things. Maybe a snapshot is taken of the cut or the bruise or the stitches that seem like something is funny about them, and you want to grab a picture of that and upload that to the EHR. So as more and more of that comes into the telehealth visit, it's important that we have all these systems working together, right? And driving adoption of the EHR and moving everything through a workflow that's efficient and creates a better experience and an operational efficiency. So that's how we think of it. We think of these three systems, and that makes us think, as we make decisions around these systems, makes us think about different things, right? We have to consider, how do people engage with a phone call, a contact center phone call? 27+% of people say that they will only stay on hold for a minute before hanging up. Well, that means we've got to really optimize, right? And we've got to optimize how quickly we get to that caller, and then we've got to optimize how we encounter and engage with that caller. How contextually aware are we of who they are and what their purpose might be. 70% of patients say that scheduling is an important factor in their care experience. And 10% of patients say they're not getting timely access to appointments that they need and want. So when they call, they have very long lead times and have to wait. Scheduling is a really, really important gate for that patient experience and satisfaction. And so optimizing scheduling becomes a really important part of that whole system. And of course, the contact center is the centralizing vehicle, like I said, that nerve center for data, single version of the truth, and being able to open the doors to a more omni-channel, multimodal experience for the patient and the clinician. The kinds of things that go on or can be workflow routed through the contact center, we've talked about several of them, like scheduling, but also billing, also handling some self-service things, referrals. If you have a relationship with a CVS, for example, in your geography, maybe those referrals for orthopedics are all going to come to your hospital. Well, how does that contact center handle those referrals and prioritize calls coming from the CVS clinic, right? And then the pharmacy, how are those routed back to a CVS or your own pharmacy? So a lot of different things can be thought through and built into the workflows in this virtual care system. Identification, verification, that's a big one, particularly as we look at the vaccination process coming up. Scheduling those appointments, but then also identifying the people who are showing up and checking in and allowing to go forward with the vaccination. At Cisco, we kind of look at all of these as being stitched together through our webex platforms. So webex is often known as the video calling platform, but we also have webex contact center. We have kind of off-the-shelf webex, which is a video conferencing capability that's used by even non-healthcare entities, business, corporate environments, and things that are non-clinical. But then there's also webex that's purpose integrated for healthcare to the EHR. And we call that like webex telehealth connector for Epic, or connectors for other non-Epic EHRs. And then of course, we have fully integrated software providers that have built workflow capabilities based around webex infrastructure, but also fully integrated into bedside and requirements for workflows that the staff engage in as well, beyond the contact center and that side of the business. And extended care is one of those. And if we look at telehealth and the way that we've all gone through amazing experiences in the last 10 months or so, these are not unusual numbers, but these are the kinds of numbers that we are seeing, and maybe you've seen them too. 2,000% increase in telehealth sessions in 1 month. These are daunting. These are just sort of really overstressing the system. From 0 to 5,000, an increase in telehealth visits over a 3-week period. These are real numbers. How do you go from 0 to 5,000? How do you prepare your environment for this kind of surge? And 750% increase in virtual behavioral health visits. This is an indicator of, department by department, how are we looking at the role of virtual care in that department's journey. Now, behavioral health was one of the early ones to adopt virtual care because it was not an exam-oriented kind of encounter. So it lent itself to a virtual visit, right? But as we hit the pandemic and we had all departments impacted by people not being able to come in, there were a lot of early thoughts that, there's just some things we can't do over virtual, which is true, obvious ones, but there were some that weren't so obvious. A lot of people said we can't do physical therapy or, PT on a virtual platform. But as you start to dissect the journey of a physical therapy patient, whether it's post-stroke or post-orthopedic procedure, there are pieces of that treatment that can be done virtually. For example, the intake, being able to watch somebody walk across a room and look at their balance, or how aligned their spine is and their knees and their gait, or looking at their range of motion by watching them raise their hands up over their head and back down again, or bend forward and see how straight the spine is, or squat down. These are things that can be done virtually. Now, the actual hands-on and manipulation of a physical therapy session, not so much right now, but maybe in the future with facilitated video to help maybe a third party at home who can help with that manipulation. That might happen. There might be more and more. But what we're seeing now is people dissecting the journey of each department and saying, which step here could be done digitally or virtually over video, and let's start to put those digital components in place to create a more efficient journey for that particular department. And as we look at the contact center and the patient engagement layer that I talked about in the virtual care system, there's many, many capabilities, and they're growing all the time. So we certainly have a plethora of ways to engage or to stand up a contact center. We have cloud-based, we have on-prem based, we have for small numbers of agents to thousands of agents that need to be integrated. And so there's a whole lot of technologies and capabilities happening in the contact center space itself. But then also on the patient engagement side, you see a few listed here. Luma, which does schedule optimization and orchestration of the patient journey. You see Spensci, which is a company that is just awesome. It has a capability of bringing the data from an electronic health record to the agent's dashboard so they can have a contextual engagement with the caller. And you see somebody like Acquion, who is a great company that helps manage outbound campaigns from the contact center. So when you have to go the other direction, not just taking the calls, but actually proactively generating calls, maybe to let people know that they need a flu shot, or certainly the vaccination coming up is lending itself to a lot of this as well. We'll talk about the vaccination here in a minute, because it is certainly going to be a driver of impact on the contact center. The types of things we're seeing automated through chatbots, like with Luma, is appointment reminders. Okay? Maybe there's a pre-screening form that needs to be done, or data that needs to be collected. So you see here the ability to automatically schedule within 24 hours preceding the appointment time to give them a reminder to fill out their digital form, right? Or again, a reminder that says click Y to keep your appointment tomorrow, or click C to cancel, or O to reach an operator to change your appointment. You see a reminder here on the right before the appointment to say, just a reminder that your appointment with the doctor is about to begin in 5 minutes. Click here to be connected. Why? Because a lot of people have trouble finding that email where the link was for the appointment, or they didn't save it to their calendar. And so that search can take up a lot of time and cause an appointment to get delayed. Whereas a quick bot that automatically resends that link, no people involvement here, that's an easy way to make sure we increase the on-time start of appointments. Several other things that are happening in the telehealth visit itself. In the patient to provider appointment, self-testing. So people being able to come into the telehealth encounter and check their audio and check that their video works, and then having confirmation, two-way confirmation that says ready and waiting to the doctor and says ready and waiting to the patient. So there's this mutual respect of each other's time. And so we know that the appointment's about to start, or the people are ready and waiting, and you can shift to actually join now. That confirmation is really important. And then when you are waiting as a patient, we have technologies that allow you to be receiving dynamically generated content, contextual content. So if you have a maternity visit or discussion, maybe you're getting content about labor and delivery. If you are post-op on back surgery, you might be getting content, video education around that, or wound management. So the utilization of that time while you're connected, there's a lot of new capabilities that are very valuable in terms of improving the outcome and just optimizing the time of the provider and the patient. And then, of course, completely being connected to the electronic health record, both for the information about the visit and the follow-ons, etc. Another big area is being able to expand that video call from just provider to patient to also including additional providers. For example, in oncology, that's often multiple providers. There's the oncologists themselves, and then there's the specialist, whether it's a neurology tumor rather, or a breast tumor or a liver tumor. That specialist may come on with the oncologist who's treating with the therapeutics with the patient. So you've got two clinicians and a patient scenarios, or you've got a clinician and multiple, a patient and a family member, right, on that side. Maybe one of those people on the call doesn't have access to the electronic health record. So how do you add them in? Maybe the second clinician isn't in your your staff of that hospital. Maybe it's a specialist from outside the hospital. So thinking through all of those different multi-party connections becomes really, really important. So telehealth in all of its glory and robust function that we've seen and experienced to now is also now really becoming part of an integrated delivery program. As we see the returning to work and the reopening of some of the face-to-face healthcare processes, what is happening to telehealth? Well, as people are coming back in now to the venue, and that is very, very dependent on them feeling safe doing so, we see a lot of focus there, a lot of technologies that are helping people feel comfortable. There's digital encounters, pop-ups that say, welcome, we haven't had an incident here, feel free to come in. You'll be alerted if something does become potentially unsafe, and we'll alert you on this device. So there's a lot of technology dealing with people when they come in, and that's a good thing. There's actually a lot more credibility when people are delivered this kind of safety information in a digital form, whether it's on a digital sign or on their mobile device. It makes them feel that it's more credible, that your organization is really tracking people when they see that number in occupancy go down when somebody walks past you to leave, and it goes up again when somebody enters. The patient starts to think, I think they've got this covered. They are really using advanced technologies to manage occupancy levels and safety and distancing. So while all of that is happening, we're encouraging people to come back and come in face-to-face. We're starting to see a dip in the telehealth visits. And while that is very predictable and logical, we kind of have to look at how many of these dips and surges are we really going to be seeing, and how do we prepare for them. So again, SG2, who we talked about earlier, had predicted that about 29% of eval and management visits were going to be in the virtual format by 2025, 2029. They now upped that to 43%. But we're going to see the dips and peaks. The first dip in telehealth you see in the orange is happening as the blue bar, the brick and mortar visits, go up, right? We expect that. But then we're going to see another, incline of the virtual care visits as the brick and mortar visits start to come down, and we start to say what parts of the care delivery can be done over virtual. And then if you look at the green bar, there's actually a continuous rise of about 9% over the next 10 years of all visits. Okay, so as all visits rise for a variety of reasons, we're going to start to narrow the gap between the in-person visit and the virtual visit. And so you see that narrowing as we go, we advance over the years, and all kind of being pulled forward by the increase in demand. And this is a very interesting dynamic between rising patient encounters overall and the split between bricks and mortar and virtual. And a lot of this is enabled by the new technologies coming in, the remote monitoring devices at home, and all of that. And so again, planning for your virtual care program means taking into account all of the different technologies that are coming that are going to augment the actual visit itself. One of the next surges that we're going to see, watching the clock here, one of the next surges we're going to see is around the vaccination. So as I wrap up today, the vaccination is top of mind. And this vaccination coming up is one of the largest scale vaccinations, distribution of a vaccine that we've ever seen in this country, with 330 million people approximately needing to be vaccinated. We will be, of course, triaging. Some of the first people will be your own employees. Your staff will be getting the vaccine, and it's a two-parter. So there's an initial injection, and then there's a 30-day later booster. So that's going to be in itself a lot of logistics to think through. Certainly with your staff, making sure everybody gets that second booster. But then as we go into the essential worker population, like teachers and restaurant workers and grocery store workers, these people are going to need to be reminded. They're going to have to schedule that appointment. So here we are back to telehealth in the contact center. They're going to schedule the appointment for the initial vaccination, and then they're going to need a reminder, and they're going to need lots of encouragement to make sure they keep that in that 30-day window to get the booster. Why? Because we can't waste the vaccine. It's going to be a limited supply to begin with. So we don't want to waste it because we didn't properly, get a high percentage of people coming back for the booster. They also need that booster and documentation of the booster to return to work. So their employer knows they received both shots and they are cleared to come back to work. So there's documentation and online reminders of click here to print your own verification of the vaccination process. There's a lot of stuff that's going to be going through the patient engagement layer, the contact center, and maybe even the telehealth program, the video call. We still don't know. Will some people have an adverse reaction to the vaccination? Will they need to have a video call or an encounter to see if the fever they've gotten has anything to do with that? There's a lot of things to think about, including pre-screening. Do we need a rapid test before you get the vaccination? How do we schedule that so that you make sure you're not COVID positive the day that you come in for that vaccination? Again, reminders, telehealth, contact center. So as we close out the session, I hope that there's been some new little nuggets of information in here and that you've gotten a good kind of overview of how telehealth is trending and the different areas that it can provide a major contribution into your care delivery program. And I look forward to answering questions that have come in, and I look forward to following up with any of you that want to reach out to me. So thank you so much for your time. It's, again, really good to spend this time with you, and all the best to everybody.